मुरगांव तालुक्याची भलायकी डेंग्यू, मलेरिया, वायवॅक्स, फाल्सीपरम सारखे वेक्टर बोर्न डिसीजांक लागून हाल्ल्या. झोपडपट्टी एरिया, कामगार वर्गात नितळसाणीची नाशिल्ली जागृती, दाटीन रावपाची पद्दत हाका लागून तांकां हे डिसीज रोखडेच जाता. चिखले कॉटेज हॉस्पिटलांत सप्टेंबर म्हयन्यांतूच 147 डेंग्यूचे सस्पेक्टेड केसी मेळिल्ल्यो. तातूंतल्या 16 जाणांक डेंग्यू जाला म्हूण कन्फर्म जाला. वायवॅक्स मलेरियाच्यो 142 केसी जाल्यार फाल्सीफरम मलेरियाच्यो 15 केसी सापडल्यो.
We admit the patients of all three diseases like falciparum malaria, vivax, dengue, provided they don't go into complications, and therefore we are always flooded with such patients. But all the precautionary measures are being taken. वास्को अर्बनी आपल्या परीन काम करीत आसा आणि we are at our level we are trying to treat them. So this is the picture overall. Of all these 147 patients which were notified at our cottage hospital Chikalim, only 8 cases were confirmed this month. And last month again there were 8 cases which were confirmed. So actually we can say that we had 8 confirmed cases in the month of September. So also 8 confirmed cases in the month of August. Dengue cases. Malaria, once we detect, they are confirmed cases only.
चिखले कॉटेज हॉस्पिटलात पेशंटांची सदांच गर्दी. 40 खाटी आसात पूण त्यो पावनात.
तांकां तुमचे कडेन रश चड गर्दी जाता आनी पेशंटांक बेड्स बीन कितें अवेलेबल नासता म्हणून भायर बीन दवरता.
Actually what happens is आमचे on the papers we have a 60 bedded hospital. But we only have 38, so you can say 40 functional beds. आता नवे हॉस्पिटल स्टार्ट जाता ताका लागून some parts are not functional. We do not have those many wards, those many beds. आणि 40 beds if we consider, that doesn't suffice for our present need for admission. And what we try at our level is, as far as possible, we admit the patient instead of referring them to Penjim, because येवपा वचपान तेंचे खूब त्रास जातात तांकां. Unless the patient goes into complications.
प्रुडंटा खातीर सुरेंद्र मडकयकार.